Hi gang, this is Dr. Katie Carter. This is a send out to all my patients and also other people who are really wanting to be in a lower risk group in terms of if indeed they get exposed to the COVID-19 virus. It also is an attempt to sort of help you connect some of the dots from some of the literature that's been coming out lately and to understand what risk factors you might need to be aware of and how you can maybe transform your life in such a way that will put you in a lower risk group. As you might probably already know, if you have hypertension, obesity, and diabetes, that puts you in a higher risk group. And then on the last 5 days, we've discovered two. We've mentioned early on that you should be on vitamin D. That's always been a very important nutrient that as naturopaths, we've always studied it, tested it in our patients, and prescribed it because there's a lot of literature about its value in not only immunity, but also bone health and also colon cancer as another thing that is a preventative for colon cancer. A lot of mechanisms in the body that demand vitamin D. And it seems to have receptor sites in just about every cell in the body. So it's really super important. There, in 2019, the British Medical Journal had an article that if your vitamin D levels were up at a higher level, you're less likely to get a respiratory illness. And so I think that was one of the reasons why vitamin D in the recent last month or two has been studied in different groups. And one of the things that I want you to know about with vitamin D is that if you have more melanin in your skin, then you're going to be less likely to absorb vitamin D from sunlight. Why is that important? Well, we can see from the epidemiology that the groups that are in New York and the inner city African Americans are faring very poorly. They're not only in the high risk groups with the diabetes and the hypertension, but they also don't absorb vitamin D very well because of their melanin, and they're in a northern latitude, so they're not getting exposed to as much UV light. Also, being in the city, there's more buildings around, so there's less likelihood of getting sun exposure. So those are some of the things that we might want to pay attention to in some of the literature. The other thing that we want to pay attention to is that a recent journal article came out that they took, one thing that we do understand is that if you were to do the blood work of people who have COVID-19 and people who don't fare well with the virus, there's an inflammatory marker that we find in the blood. It's called C-reactive protein. It's a common blood marker that we often look at in people's blood, especially people who have inflammation. What we're finding is that people's C-reactive protein is higher in people who do not fare well with the virus. C-reactive protein is also shown to be lower in people who have adequate levels of serum vitamin D. That is not true if a person is being given boluses of vitamin D periodically. It seems that taking vitamin D at a steady amount, those people seem to fare better than the people who are given boluses. There's another study that showed that there's tremendous amount of 20 different countries were studied in their in respective to the mortality of the COVID, and they found that if your mean levels were higher in each country in Europe, then those people did a lot better. So that's another thing that we really want to pay attention to is that study. I early on started really getting involved in looking at an interactive map and watching counties that had a lot of exposure to COVID virus but didn't. They seemed to fare well and they didn't seem to succumb to the virus like other groups of people did. And there were certain counties in Utah that struck me as doing very well. Very few deaths, but a lot of exposure. And what I know about some of those communities is that they live in the mountains. There's a lot of sun exposure. They value exercise and fresh air and health in general, in terms of a general culture. And at Gallatin County in Montana, the same thing that I noticed there, which those are some of the things that are valued by, as a culture. So that kind of leads me to talking about something else, and that is that I want you to be aware that being told to stay inside for these months is not a healthy decision. I think that we can social distance and be outside, and I'm very concerned about the children that are being told to stay inside month after month, or day after day, week after week even. We need to get outside, we need exercise, we need to be in the fresh air, and now we know that we need the UV light. If your physician has put you on vitamin D before and hasn't ever tested your values, that is something that we test. I test on patients for the last 34 years. I've been testing vitamin D levels. I find the value of it quite extensive. And I would suggest that you can come in and we can get your vitamin D checked. The other thing is we can write an order for you to have it checked. Right now, I'm suggesting that if you haven't been on vitamin D at all, that you probably might want to take a few days of taking 20,000 units, and then the going dose that I'm recommending for my patients is around 10,000 a day. I have a wonderful supplement that has vitamin D, vitamin A, and vitamin K, so I would suggest that too. Also, I just really want to encourage you to let me know if you're having any issues with weight gain, hypertension, your blood pressure isn't doing so well. We can do telemedicine. We really need to talk about what's going on for you. It's ironic because there's a lot of people gaining weight right now, and that's actually one of the things that is seen as putting you in a higher risk group. So there's lots of ways that we can work on that issue. The other thing is that remember, gratitude and relaxation is really helpful for toning down the interleukin 6 part of the cytokine pathway that can get out of control with this virus. So I just want to encourage you to have gratitude every day, and be so thankful for what you have, and for how beautiful our country and the people in our country are treating each other, and day to day how wonderful and kind people are to each other. So this is a send off to everybody, and take care, and I hope to talk to you really soon. Bye now.